Do you know the difference between acetaminophen and ibuprofen? Or when to use which? Acetaminophen is often known as Tylenol or other brand names. It is classified as a pain reliever, analgesic, and fever reducer, antipyretic. Ibuprofen is often known by its given name, but you may also know it as Advil or Motrin. It is classified as a nonsteroidal anti-inflammatory drug, NSAID. Other members of this drug class include aspirin and naproxen, Aleve. As you may have guessed from the descriptions above, acetaminophen is best used for fever, aches and pains, but will not be very helpful if the pain is due to inflammation. Ibuprofen is more helpful for these symptoms when inflammation is the cause. Inflammation examples include menstrual cramps and arthritis. Side effects. Both medications are available over the counter (OTC) and in brand name or generic forms. Both could cause side effects like rash, nausea and headache, but they also have separate side effects. Acetaminophen may cause side effects such as hypersensitivity reactions, skin reactions, kidney damage, anemia, reduced number of platelets in the blood, or liver failure. Unless directed by a physician, acetaminophen should not be used for longer than 10 days. Ibuprofen may cause side effects such as ringing in the ears, dizziness, drowsiness, abdominal pain, diarrhea, constipation or heartburn. NSAIDs also reduce the ability of blood to clot, therefore increasing possible bleeding after an injury. Those with asthma are more likely to experience allergic reactions to ibuprofen and other NSAIDs. Please note, acetaminophen is shown to be safe for pregnant and breastfeeding mothers. Ibuprofen is not recommended during pregnancy but is safe during breastfeeding. Be sure to ask your primary care provider about any interactions that acetaminophen or ibuprofen could have with other drugs you take. Recommended doses. Ibuprofen. Adults, for mild to moderate pain, 200 to 400 mg every 4 to 6 hours. For arthritis, 300 to 800 mg, 3 to 4 times per day. Maximum daily dose is 1.2 grams. If a physician is supervising, they may allow up to 3.2 grams per day. Do not use ibuprofen for more than 10 days for pain or more than 3 days for fever unless directed by a physician. Children 6 months to 12 years, 5 to 10 mg per kilogram of weight every 6 to 8 hours, not to exceed 40 mg per kilogram daily. Acetaminophen. Adults, 325 to 650 mg every 4 hours, or 500 mg every 8 hours if using immediate release formula. For extended release caplets, 1,300 mg every 8 hours. Children 12 to 17 40–60 mg per kilogram of weight every 6 hours, not to exceed 3.75 grams or 5 doses per day. Children younger than 12 10–15 mg per kilogram of weight every 6 to 8 hours, not to exceed 2.6 grams or 5 doses per day.